has made great strides in healthcare, from reducing infant mortality to expanding access through initiatives like Ayushman Bharat. Yet, challenges remain: malnutrition, anemia, rising non-communicable diseases, and gaps in rural healthcare. Infectious diseases like tuberculosis and dengue still pose threats. To build a healthier nation, we must focus on prevention, nutrition and awareness, and for that we need a large number of public health experts in the near future. To address this, the leading University of Haryana, Maharshi Dayanand University, Rohtak, which is situated about 70 kilometers from capital of India, New Delhi, had started its 4-year bachelor program in public health sciences to prepare competent professionals for the pressing healthcare challenges. Hello everyone, I am Professor Munish Garg, Director, University Institute of Public Health Sciences, MD University, and it is an honor for me to have with me an eminent physician, administrator, researcher, Professor Narendra K. Arora. Many of you must have seen him on television during COVID pandemic, and he was the chief of COVID vaccine distribution strategies network in India. Welcome Professor Arora to this program.
Thank you very much. It's such a pleasure to be here.
So before we go further the conversation, let me tell you that Professor Dr. Narendra Kumar Arora, MD-Paediatrics and MSc in Clinical Epidemiology, is an Executive Director of INCLEN Trust International since 2005 and a leading global expert in immunization, vaccine safety and child health. A former faculty All India Institute of Medical Sciences in pediatric gastroenterology, hepatology and nutrition, he became president of AIIMS Deoghar in 2018. He has key contributions including Pulse Polio Immunisation Program, vaccine hesitancy, etc. He has shaped India's vaccine policies and pandemic response. Besides, Professor Arora has held prominent roles in WHO, playing a vital role on influencing global vaccine strategies. So, welcome Professor Arora to this program, and we are delighted that you have spared time for us on this program.
Thank you very much, sir. Look forward to this important conversation.
So, while starting this program, you were a part and you have given us a lot of time regarding this developing this program, that is Bachelor in Public Health Sciences in our university, and regarding the preparing academic plan, designing the curriculum framework. So, what do you think about this program in our university? How do you see this program in our university?
So, Munish, the important point is that why do we need public health professionals in this country? And when we look at the overall public health scenario and the performance of different states, we find there are very few states where we have public health cadre and public health experts managing the public health system. And there we find the program performances are very good. The second is it has influenced the health indicators in those states, and they are far ahead of the national average. And in fact, in some of the states, the health indicators are almost approaching the global benchmarks. And role of public health professionals in these states is considered a very important component. So when I look at this perspective, then it becomes important that public health experts play a pivotal role in improving the quality of public health services in our country. And recently, a very transformative policy initiative has taken place, and that is establishing health and wellness centers, or they are also called Ayushman Arogya Mandirs. And it is here that is the distalmost part of our health system or limb, and role and need for public health professionals start from there. While doctors look after the individual patients or group patients, but the whole architecture of our public health system or health system has to be managed by a group of people who understand health, the epidemiology, the imperatives, and also are able to facilitate and support delivery of services at the right place and the right point at in the appropriate manner. And for all this, the most appropriate professional is a public health professional. And when we look at this, then I would like to congratulate the university to have taken a policy decision and decided to start this bachelor's program. And you have started this program as part of the new national education policy, where it is a 4-year program. So it and this the children are being picked up right after class 12. So they are a clean slate and they are just focusing on developing their public health skills. I think that is a very important step forward. Many times, and which is going on all over the country, that people already are professionals for various backgrounds and they go in for public health for 2 years or public health master's program. But here we are taking a group of young people who have decided to pursue public health as their career, full-time career. And therefore, focus and the way they have to be trained will have to be different as compared to the traditional MPH programs. So I have a lot of expectation and also confidence that the students coming out with this comprehensive 4-year bachelor program will make a major difference and dent to the national public health system.
You're right, Dr. Arora. When we were planning this program, then we observed that there are only a few institutions who are offering this bachelor program, and even in those programs there is a disparity. Some are offering 3-year program, some are offering 4-year program, and the eligibility conditions are not also uniform. So since you have played a key role in designing the curriculum, that we have consulted the curriculum of at global level, that how we can prepare the competent professionals, and then we have decided that from the science streams we will select the students, and then we will train that they will be a very useful part in the healthcare system. So how do you see the difference between the public health setup in India and as compared to the global scenario, since you have traveled worldwide, and how you can see this thing?
So first of all, I was just having an interaction with the students, and one of the students made a very important component. The student, this young man said, that this young lady said that I want to contribute differently as compared to a doctor or a nurse.
Yes.
And that is why she decided to take this public health course. And that is precisely, I think that sums up the philosophy of this 4-year bachelor program.
Correct.
What it is telling us is that rather than thinking this is as a traditional biomedical program or a medical or a doctor like program, we are preparing people who understand the whole concept of public health and how those issues can be addressed within our architecture.
That's correct.
Of our health system.
Yes.
And I must tell you, you asked a very important question in terms of that as compared to the rest of the world, how is our health system structured? And I would like to say, as a matter of pride, this is the structure wise, it is one of the very comprehensive and very fine program. We fail in implementation.
Okay.
And implementation of the programs and delivery of the programs, to the sense that those who are the beneficiary, we should be able to reach up to them with the right package of services. And it is here that we need a re-engineering of the whole system, and manpower is a key component, and manpower who is trained within the context of our public health requirements, our community requirements, and so that they can deliver. And from that perspective, the way curriculum was developed, it ensures that there is a cultural sensitivity taken into account, the ground reality of health system is taken into account, and then how these people can facilitate and catalyze delivery in a mechanism that the last person, the most inaccessible person in this country, those who should be able to accept the public health services, and because ultimately we want a healthy society.
That's correct.
We want a well society, because health and wellness is the other part of the coin, which is the wealth of the society. And COVID has told us very much. And this program has been designed primarily to keep that philosophy in mind.
So, can you elaborate at what level public health experts can contribute in the healthcare system? What should be the cadres to be developed into the healthcare system in India, so that our programs are implemented effectively? And other thing also, that so that we can prepare a healthy society and we can prevent also the outbreak of diseases like COVID and similar other examples. So, how you can see
so
that?
I would see various levels of public health professionals are required. While at the distal level of distal limb of our health system, where I just mentioned health and wellness centers, primary health centers, community health centers,
Okay.
they should be able to bridge or bring the society closer to health system and act as a bridge, and provide services in a manner which is accessible, which is also acceptable. I am not talking about affordable, because government is providing the service.
Okay. Yes.
But both accessibility and acceptability is very important. And so even in those part of the communities, access does not mean just that it is distance. Many times we see within 100 meters somebody is staying and they may not come to that public health system.
Yeah, right.
That means when I am talking about accessibility and acceptability, then it also means that I have to build trust and confidence in my community that the services I am providing is world class. And I am providing this public health services not as something meant for poor or those who are marginalized. No, for every section of the society this service is good. And therefore public health professionals have to be cognizant of the requirements of the system, how everybody accepts and it is accessible, and this whole chain of events, whether it is logistics, it is supplies, it is organizing the clinics, it is monitoring the services, it is ensuring that the quality of services are maintained and grievances of the community are taken care of. This kind of, when I look at the whole services in a comprehensive manner, so I require at that level. And as we move up the ladder, then issues of referral systems, and from referral systems to program managers' task, and from program managers' task to, I would say, the policy makers' task, the role changes. But unless I have a ground understanding, I will not be doing justice as I move forward. And that is how I foresee in coming decades that public health system, on one hand, it's a continuum of service right from the ground level to the highest level at Director Health Services, or even tomorrow we may have ministers who are public health experts.
Right. So I hope that in the coming years there will be ample opportunities for the public health graduates and in various fields.
In fact, I would add, I feel so excited about public health.
Yeah.
I think in coming years, one of the Nobel Prize winner may be a public health expert.
Oh, that's great.
Because the reason is the whole re-engineering, innovation is required. How do I ensure that 100% of my population, 100% of my community gets the service which is intended to reach them? And it requires new thinking. It requires moving beyond the usual paradigms of public health. And we also need young people who are driven by the passion that they want to improve the public health system, and they are not diverted of their initial background.
That is very, very interesting, Dr. Arora, and I hope that the future students, the aspirants would be listening to this conversation who would be planning to take up this course. And I must tell you all that from the next academic session, that is 25-26, we will be opening the admissions, and you can take the admission, and for the international students also. So this conversation will reach to the entire world, I would say. So if any international students can pursue this course, you are welcome. And so I am very excited and very, very happy. So we are talking about a lot of opportunities as a student. So how the students should improve their skills or prepare their skill set to get into this profession properly?
So one of the important things, as I am repeatedly emphasizing, is that I must understand my context very well. And context means cultural context, social context, economic context,
Okay.
religious context.
Yes.
All the context I have to understand well. And then when I deliver the services, it has to get aligned with those contexts. And therefore, acceptability becomes very important in this. The second dimension is the quality of services, the way things are handled. For example, if a lady comes to me for delivery in a primary health services, I have to provide the right kind of respect. So a respectful maternity is very important component. Similarly, sanitation, hygiene is important. Similarly, the biomedical waste disposal is important.
Correct.
And all this is important in addition to the technical part of the services. That means delivery services, the way it is done in a scientific manner, the way newborn is handled, the way I identify high risk pregnancies, and also take preemptive actions so that the mother is healthy, baby is healthy. Now this all requires a very public health approach.
Yeah.
And therefore, I see the opportunities for public health professionals is going to increase. And so the job, the country is contemplating for a national public health cadre. Who will be better suited than a student like this? And as I said, there are almost 176,000 health and wellness centers. Along with this, there are PSCs, CSCs, district hospitals. Surveillance activities have to be done, and all this requires public health experts. In addition, once we have the public health cadre, then the professional along with career movements also improve, that the people who join at the grassroots level can tomorrow become the leaders of public health systems. So there are huge opportunities in terms of government system. Similarly, research organizations require these people, because those who work in community, who is better than such kind of. Another dimension, I must say, many of our young people are interested in international organizations like WHO, UNICEF, World Bank, and similar other UN organizations, development agencies like funding agencies. And they also require, because most of the times, whether it is in India or other low and middle income countries, it is the public health system weakness and implementation that needs to be improved. And for this, people who have experience and trained and have a skill set to look after the people in our communities, they are most suited and they will be taken up very. So, job opportunities are immense. There is a huge gap in terms of whatever numbers are required and what is available. So, I see this as a very attractive life opportunity or a professional opportunity for young people. They should very seriously consider. And as I said, that you want to be part of the health system, but you want to be different than nurses and doctors, then public health professional is the right profession.
So, can you name a few skill set that the students should develop so that they can position themselves into the public health sector? And like you said, that there are prestigious organizations, WHO, UNICEF and CDC, and the students are willing, I mean they are willing to go there. So, what things are required to reach for them to that level?
So, one of the first things, important things a public health expert should understand is epidemiology. Understand the burden of problem, how to do surveillance.
Right.
The third thing is they should also understand how to collate data and interpret data, statistics. Then they must have managerial capacity, the kind of organization which is required, whether it is organizing the logistics, organizing an outreach clinic, seeing that the patient is being taken care of properly, quality issues, and the other dimension which is required is that I should be able to interact and engage the community. So, these are various skill sets, and if I want to learn these skill sets, it is important that I should be, as I am getting trained, a student is getting trained, they are very closely working, interning and practicing within the existing health systems. That is a very important component. It cannot be a classroom teaching alone.
Right.
So, if I have to understand the realities, what are the barriers, what are the facilitators of our health system, and if I have to overcome that, it means I need to work. So, just like doctors work during their MBBS in hospitals, in wards, our public health students should be working in health system to see what are the barriers, what challenges have to be taken, to be resolved, to be understood and resolved, and that is the kind of skills. And so, we need to have, I want to have a 360-degree skilled public health person, didactic or theoretical classes along with practical in the field with public health system is to be there.
Right. Thankfully, we are having these components like practical exposure in the society, internships in this curriculum to have the hands-on training and hands-on experiences. So, we are having this component, and now what should be the public health experts have their roles into the community engagement means more effectively?
So, community engagement, as I said, if I want to understand the context, then I need to engage with proactively.
Right.
Nobody is going to call me.
Yes.
So, I need to be understanding the local dynamics
the local socio-cultural milieu.
Correct.
And that clearly means I need to be interacting with local leadership. But I cannot stop just at local leadership. I have to be working with the women, with the children. I have to be working with the elders and the adults, and also understand their economic situations. So, in an agriculture society, in an industrial society where there is a lot of industry are there, or in a market or where business like societies, what kind of expectations my community is having, and for that I have to go out and interact with them, interact with non-profit organizations or NGOs who are working, who are like a bridge between community and the system. So, community engagement has to be integral part of any kind of public health training.
You are right.
I sometimes feel that public health expert also almost has to have those nuances and those understandings just like a politician have, because health is so much integral to us, and health is affected by so many things around around us, our
yes.
ecosystem. So that I need to understand all those. If I prescribe, if my system prescribes a medicine and that medicine is not available in that area, or that medicine is very expensive, this house cannot afford, or the taste of that medicine is not acceptable by the child, I need to understand and work in that sense.
Definitely.
So, it requires a complete understanding of the community in which I am working.
Definitely. Just I want
similarly sorry for interruption, that conflict areas, if I am working in a Naxalite area, or if I am working, let us say, in DRC Congo in Africa, where there is lot of conflict, Somalia, and there I have to deliver services, I will have to understand the community,
understand the
and work dynamic. So, understanding a public health person is just not delivery of medicines or vaccines,
yes,
or doing seeing surgery. One has to understand all this.
Yes,
and
definitely.
That requires live hands-on skill.
Definitely. Since our university is interdisciplinary in nature and we have 40 different departments in our university, we have a very good life sciences faculty, we have management sciences, we have law, we have social sciences, we have pharmaceutical sciences. So, how do you see that, how they can contribute into the public health program, the other departments of the university?
So, in fact, I would say it is a divine design that this program is embedded in a university where there is a medical college also,
yes,
and then there are so many other departments. And today we are talking about One Health. One Health means medical, human, we are talking about animal, we are talking about environment, and we are also talking about agriculture and the management and others.
Yes.
And therefore, if a program is embedded in a university where all these are within the campus, I think students should feel themselves to be very fortunate. And I am sure as director of the institution, it becomes your responsibility to see that there is a very close collaboration between various departments, disciplines, because public health is truly interdisciplinary.
It's truly interdisciplinary.
And I think the best utilization and translating that philosophy can be in a university milieu like yours.
Definitely. So, in the near future, we will be going for collaborations and having the research work in the society community. So, what would be the opportunities of collaboration and research and funding opportunity for our university for this program?
So, one of the most important research area which I think where our country will benefit and the society will benefit is implementation research. That implementation research means that the way programs are prepared, designed, but we know that as a system, as the Department of Health, this delivery component and the performance issues are
performance
important.
issues are there.
And that requires implementation science.
Okay.
How within the constraint. Now, if I say I need 10 this people, 5 this and all those and so much of, no, whatever I have within the constraint of whatever I have, how best I can improve the performance. So, implementation research is one.
Implementation research is one.
Then the second is areas we have lot of public health programs which are not showing impact. We must try to see what is the problem. Is the basic fundamental thinking process requires revisit, or it is just the delivery? And we find that there may be programs where basic thinking process needs to be re-looked at. Third dimension is that development of new packages of services, delivery of services, because we are now entering into an era which is where India is going to have a lot of non-communicable disease, cancers. So, one very nice example which is a challenge is screening. If I want to do cervical screening or oral screening for cervical cancer, oral cancer or breast cancer, this requires thinking, because at the moment program is not able to. The screening is just 1 or 2%, which is practically like not having it. If I want to reach a level of 75%, a lot of ground has to be covered, and this cannot be covered in the traditional thinking. This requires research. And again, this is a very important research area. So, there are a lot of one has to start thinking in a focused manner. If I have to eradicate measles from this country, we are at the last leg. What are those barriers and how do I move forward? If I want to have TB control completely, and there is a national commitment, but there is a lot of gap. What are the, whether it is diagnosis, whether it is treatment, adherence, or it is nutrition related issues. So, these are all researchable areas, and funding today is available from several sources.
Okay.
Indian Council of Medical Research is there, Department of Biotechnology, new diagnostic kits and other things which require very large. Like COVID is a very good example where Indian entrepreneurs came up, and a test which was initially almost 3,000 rupees, one test for COVID PCR, and today this test is available for 300 rupees.
Yes.
And this is India. Our new India can do anything in that way. And so Department of Biotechnology, Department of Science, CSIR, ministries, state governments can provide funding. Similarly, I would also suggest philanthropy. There are a lot of trust, industry CSR money is now available for research, and so CSR money can be approached for various kind of research activities.
Incredible, Dr. Arora. So, we are nearing to the conclusion of this conversation. What message would you like to share with the students of this university or young professionals entering into this field?
So, my message is that we are now in an era, golden era of public health, and most of now the development and investments is going to come in public health. And therefore, if our young people take public health as a profession for life, they can be assured of a very bright future. It is equally important that this requires a very different kind of passion and commitment and a complete focus on this area. And the way I see this program, that we are picking up people immediately after class 12 with a science and biology background, and if they commit themselves, so we need to have some kind of an aptitude that we are going to take public health. The future is going to be bright both as individual level for the professional and also for the society and the country at the larger level, because such professionals can transform our whole health scenario and wellness scenario of this country.
So, thank you very much, Dr. Arora. It was very useful talk, and we appreciate your time and concern toward this program. Again, we thanks from our heart that you have contributed a lot developing this program, and we would require your guidance in the future also.
Thank you very much, sir. I am so honored.
Thank you very much, sir.
Thank you.
Honors is ours. Thank you very much. So, this is the end of this conversation, and we will be keeping this initiative alive, and we will be doing more of such conversation for the society and the community. Thank you very much.